One thing I can tell you about alcoholism and alcohol abuse is that the thinking has changed to some degree lately. It used to be considered that either you're an alcoholic or you're not, that there's this bright line between the two. We now know it's really more of a continuum. There are the hardcore alcoholics, there are problem drinkers at the other end of the spectrum, and it's sort of vague in the middle. But I think what's even more fascinating is that according to the National Institute on Alcohol and Alcohol Abuse, they're taking it even a step further, saying with a single screening question, they can do a pretty good job at identifying who is likely to cross over into the more alcoholic sort of frame of reference here. Take a look at these questions. For men, for example, they say, on any given day in the past year, have you had more than 4 standard drinks? Okay, think about that for a second. Also look at the question for women. On any given day in the past year, have you had more than 3 standard drinks? Now, you're listening to these questions, and perhaps you're saying, yes, I fall into this category. No, I don't. Here's the point, according to this particular institute, is that if you do fall into the category, you're going to be flagged, or you could be flagged. You're going to fall into almost the highest 1/5, or 19% of people who are likely to have some sort of addiction to alcohol or have alcoholism later on. Again, the idea is this: after studying 43,000 people and coming up with this screening question, that you can start to identify people early on, even in their doctor's office, their general practitioner's office, to get a sense of who's likely to have trouble later on. They even have these videos that they put together for doctors' offices using actors. Take a look at what they have.
Do you think I'm an alcoholic?
Based on what you've said, you do have signs of alcohol dependence. Your depressed mood, insomnia, and fatigue may well be caused by your heavy drinking.
So the point again is that a lot of addiction can be caught early, can be caught in doctor's offices with training, simple training like the training that you're seeing there. Now, throughout the rest of the week, I want to be talking about what has become some of the best treatments for addiction. Now, as you might imagine, this is a controversial point. There are hundreds of millions of dollars poured into this, both in treatment and in terms of diagnosis as well. How do you figure out what's best going to work for any given individual? There are some things that surprised me as we were working on this documentary. First of all, again, there is not this bright line between addict and non-addict. And there is sort of this gray area, this vague, nebulous area. But also, it used to be thought that once an alcoholic, always an alcoholic. And that thinking seems to not ring true anymore either. There are a lot of people who seem to get better on their own, even without treatment. How do you identify those people? What makes them more likely to get better versus other people? What makes them less likely to pass it on to their kids or their grandkids? This is a fascinating special we've been working on. We're going to have a lot more throughout the week and certainly this weekend as well.